Colorado is now America's COVID hotspot. It's become our fourth leading cause of death this year. And the state's new hospital crisis order out today means that the National Guard can now come in to help. Bottom line is you don't want to need a hospital in Colorado for any reason right now. I mean, go if it's an emergency for sure. But know that 93% of ICU beds are full. Patients can be involuntarily transferred anywhere in the state. And the crisis order from the state today acknowledges that hospital care is going to be worse than usual. The goal is to, quote unquote, gracefully degrade medical care. Crisis standards of care is what it's technically called. It allows hospitals to postpone non-emergency procedures, gives them more leeway to shift their staff and have them work longer hours. The National Guard can come in to do non-medical care, like checking people in at the front door. Patients' family members and volunteers may be asked to help with feeding and bathing. And hospitals are also given legal protection from lawsuits if the quality of care suffers. This is what happens when the healthcare system is stretched to the breaking point. The state's declared all of Colorado a high-risk area, which means every adult is eligible for a vaccine booster, no matter which shot you got originally. So, as long as you're 6 months out from your original Pfizer or Moderna or 2 months out from a J&J shot, you've got the go-ahead for a booster. The state order says the vaccine providers aren't supposed to turn anybody away, but we know from your feedback that you may need to get a little creative when you input your information online to get an appointment, because some providers are just going by the federal rule. Right now, about 25 Coloradans with COVID are dying each day. It has become the fourth leading cause of death statewide this year. The state's still compiling numbers for 2021, but they gave us an early look at what they found. COVID is Colorado's fourth leading cause of death in 2021. Only cancer, heart disease, and unintentional injuries like overdoses and car crashes killed more Coloradans. That only includes cases where COVID was the underlying cause of death, not merely a contributor. The pandemic's history suggests the worst of this wave for Colorado is still ahead. First, cases will plateau, then hospitalizations, and lastly, deaths. Our cases climbed again today. Hospitalizations are at a record for this year and rising faster than they were last week. And it's primarily unvaccinated Coloradans. They're the minority statewide, but make up 79% of hospitalized patients. All that considered, do not expect an indoor mask mandate or business restrictions. We had those last time hospitalizations were this high in Colorado, but Democratic Governor Jared Polis said today, this time around, 62% of the population has chosen to protect themselves through vaccination. It sounds kind of brutal to put it this way, but the governor's position is basically that this wave of the pandemic is mostly hitting people who have opted in for it. And that's somewhat true unless you're a vaccinated person who needs health care for any other reason. Researchers at the University of Washington have modeled out a couple scenarios of where this goes from here for Colorado. Now remember, some of their past predictions have been spot on, some have been way off. Their Institute for Health Metrics and Evaluation projects our daily COVID deaths to exceed 35 a day by mid-December if nothing changes. That's the purple line. It'd be twice as bad if the variant spread twice as quickly. That's the red line. Green line models 95% mask wearing in public. Pretty unlikely without a mandate, but that model has deaths dropping to 3 a day by February. The UW models reflect what we see at vaccination clinics as well, that the Coloradans who want the vaccine already got it. Their modelers predict only a 1% increase in fully vaccinated Coloradans in the coming months.